Hi, this is the first of our board headline films which aim to give you an insight into the discussions and decisions which took place around the board table this month. We're going to be producing these films on a regular basis after every board meeting, and I hope you're going to find it an interesting and useful resource to keep you informed about your trust and the hospital. At the board meeting this month, I presented on the Trust's priorities for the current financial year through until the end of March 2014, and set out the 6 key areas for us to focus on to ensure we remain a provider of really good, safe and sustainable care. Our 6 key priorities for the coming 12 months are going to be patient safety and quality, patient experience, engaged and motivated staff, making the best use of our resources, innovation, and improving our external engagement and partnerships. I really want these priorities to give some focus and sense of direction to the organisation and to you, all of our staff, so we're all clear about the direction in which the hospital's heading and that we can all pull together to get us to where we want to be. We're going to produce a separate film which sets out our priorities and our actions we're going to take to achieve them, and these are going to be posted on our YouTube channel and on our intranet site. We're going to also be working with all of our departments and staff across the hospital to help you understand the reasons behind our priorities and what you can all do to help us achieve them as an organisation. One of the really positive stories we talked about at the board this month was the Trust's successful bid to the central government for funding to develop a new electronic health record system. Gaining this funding, which for us is around about £15 million, is a massive opportunity and a really exciting chance for us to transform the way we deliver care within the hospital. We're just now in the process of developing the specification to go out to tender to find a supplier to come and work with us to implement the solution, which will start probably sometime next year. This is a long-term project, however, and it's going to be critically important that we get staff from across the organisation in both clinical and non-clinical roles involved in helping how the system is implemented. So I'd really encourage you to get involved and put yourself forward if this is something that interests you, because we'll be needing lots of volunteers to come and help us make the implementation a success. A really important part of our board meetings every month is the patient story, where we hear real experiences of patients or families who've had either a good or bad experience of services within the hospital. This month we heard a story about a patient who had had his elective surgery cancelled on the day, causing him a significant inconvenience and anxiety, and which made him particularly annoyed with the way in which the process had been run within the hospital. The positive thing out of this scenario was that it has led the staff involved in the patient's care to really look at the effectiveness of our processes in place to make sure that patients coming in for that particular type of surgery are assessed and dealt with in a more timely and efficient way. And changes are now being made in the way in which we manage those patients to minimise the chances of similar cancellations occurring at Yeovil Hospital in the future. It's really important for us at the board to hear these kinds of stories, and it's equally really important for staff to feel empowered to challenge the existing ways of working to make things better for our patients. As I said, we have patient stories at every board meeting, so if you or a member of your team are particularly keen to promote a story or let us know about a patient's experience that you'd like discussed at our board, I'd encourage you to talk that through with your matron or Associate Director of Nursing, and we'll endeavour to get that story at our board meeting in the future. We heard also from Helen Ryan, our Director of Nursing, about a new consultation that's being undertaken by the Care Quality Commission, or CQC, as it sets out to change the way in which it regulates care services following the Francis report. We're working hard within the organisation on a trust-wide response to the consultation that the CQC have issued, but we've also acknowledged at the board how essential it is that we focus very much internally on the quality, safety and dignity of the care we provide to our patients. We're going to be doing some work internally to look to assure the board that the standards of care that we provide remain high, using some of the measures that have come out from the Francis report, but also in the government's response to the Francis report called Patients First and Foremost. It's really challenging at the moment in the NHS with a plethora of different reports and recommendations coming out by which we need to improve our services. But work like this, which we're doing internally, is going to further enhance the really positive reputation that YDH has and the strong ethos of communication, attitude, respect and patient environment which make up our eye care principles. Specific mention was made about the great work of the hospital's infection control team, whose annual report featured in this month's board papers. Despite an extremely busy winter and spring, our infection control rates for norovirus, MRSA and C. difficile have remained extremely low and on target. This is a testament to the expertise of the infection control team and the high standards employed by the staff across the entire hospital. We also reviewed the annual report of the research and development team, who again have had a fantastic year and delivered a really great service to us within the hospital, making sure that research and development is a core part of what we do within this organisation. The board received an extremely interesting and valuable report produced for us by an external organisation, setting out the challenge that this organisation faces in the future, particularly in light of the financial and demographic challenges we're all facing, in common with many acute trusts across the country. All of this leads to diminishing income and an increasing demand, which have all the potential to collide at the wrong time in the next 10 years. Whilst the picture painted in the report is stark, it's crucial that we're aware and alert to the mounting pressures that the whole healthcare system is facing, and in particular what this means for us here in Yeovil Hospital. Being aware of this gets us onto the front foot so that we can start to develop services now which will meet the needs of our patients and commissioners in the near future. We're going to be sharing this report with staff from across the organisation in the near future, so I'd really encourage you to take a look at it, as it is a very accurate and detailed presentation of some of the real challenges facing us in the hospital and the wider health community within Somerset. Finally, Mark Marriott, who's leading our continuous improvement programme, presented his regular report to the board. There's lots of really good work going on across the organisation to identify and capitalise on opportunities for improvement, where this makes things better for patients and staff, but also reduces our costs. The CIP report is being regularly updated, and we're going to make it readily available on YCloud and the Trust's intranet, so everybody across the organisation can be aware of what's going on and who to talk to if they've got a particular idea of how we can improve services and reduce our costs. That's a very brief summary of some of the topics we talked about at the board this month, and hopefully you've all found that interesting and informative. I appreciate that often the board of the organisation can feel quite distant and remote from the front line, and this is an attempt to try and bridge that gap and bring things closer together so people on the front line are able to understand what's being talked about at the board meetings. I'd encourage you also to give us any feedback if you found this helpful, or if you found it too much information or too little information. If you have got any thoughts or feedback for me, please let me know. You can email me at my YDH email address, or you can contact the communications team. As I said at the beginning of this, we're going to make this a monthly event, so we look forward to giving you an update after the next board meeting in July on what was talked about at that meeting. Thanks very much for your time.